My name is Marie Thomas. I'm an LPN, had infectious mononucleosis many years ago when I was finishing up nursing training. The Epstein Barr virus titer that they did at the time was off the end of the charts. It was around 959. Normal's about 20. And that's what they used to diagnose my chronic fatigue at the time. Some years later, I had to get back again, went to the doctor. He diagnosed it, and the only thing he could tell me was to go home and get a lot of rest, take some vitamins. I was sleeping 18, 20 hours a day. I could get up in the morning, go take a shower, go back and sleep for 4 hours. Get up, maybe make myself a quick sandwich for lunch, go back and sleep for about another 4 or 5 hours. I had no life. And this went on for quite a while. I got to the point where I was sleeping 18, 20, 22 hours a day. That was on for about 2 years. Then my son came down with a very similar last case of chronic fatigue, and he'd had it repeatedly. Anyway, at the same time, he went to see Mike Jones. Mike talked to his support group one time. So my son went and said, "Mom, I'll refer you to Mike Jones if it works." 4 weeks later, he called me back and gave me Mike's phone number. I went to see Mike. I couldn't drive the hour and a half to see Mike. I was so exhausted. My symptoms, I had aches, headaches. The worst part of it, I think, for me was the memory fog. I couldn't remember anything. I could read some sentences and just could not reprocess it. Depressed. I was very, very depressed and ached all over, hurt all over. I had no life. So I saw Mike. 4 weeks into seeing Mike, I showed great improvement. My husband continued to drive me to Mike's twice a week for treatment, and he noticed the difference every time I came out of Mike's office. The aches went away. The headache went away. Gratefully, the best thing for me was the mind clearing up. I was able to read again, to be able to focus on what I was doing with much better memory. The thing is with Mike, if you're going to do the program, you need to be able to follow his program. It's not difficult. There's just some different exercises to do, change your life a little bit, and make the commitment to making yourself better, and it actually does work. Previously, I tried things like acupuncture, chiropractic, the supplements helped a little bit, but I didn't need to do those things anymore. And with Mike's program, it just takes some commitment and much easier to do. The neurological exercises are what will make the difference for you. You need to do this. This is maintenance. It's just part of my life. Some people get up in the morning and they go for a walk, they do whatever else. I do the neurological exercises and they keep me well. I follow his programs and my symptoms are gone. And my life hasn't been all that easy otherwise. I've had the ups and downs that most people have. Right now, I'm working full time. I'm still an LPN. I work for home health. I'm on the road all day, seeing 6 or 7 patients a day in their own home. I go home, take care of my mom. My mom's 95. She's not too well. She needs care, so I do that. I have a husband who's stuck with me through all this, and so I have a good life with him too. And at the end of the day, I get to sit down, pull out my fabric, and play. I quilt. I get to do that again. I couldn't even remember how to do it when I was so sick. These are the important things that really make my life worthwhile. I very much recommend Mike's process. Mike's program works. It will make you healthy. Commit to following his program, and it will definitely work. Mike Jones gave me some information. The Dorland's Medical Dictionary defines cure as a successful treatment of a disease or wound. Dorland's definition of a wound is a bodily injury caused by physical means with disruption of the normal continuity of structures. It's the same thing with chronic fatigue or fibromyalgia. Mike has been successfully treating chronic fatigue and fibromyalgia and those who are diagnosed with it. As documented by Dr. Leonard Nell, he's an orthopedic surgeon, and Mike has the physician's research to back up this treatment. People have been able to return to a normal lifestyle, free of the restrictions of pain and fatigue and the other symptoms that characterize these diseases. I can do anything I want to do now. I watch my diet. Yeah, I eat some of the things I shouldn't now and then, but I get back on the program diet-wise, stick with the neurological exercises every day. That pretty much starts my day. I figure this is part of the start of my day. I program it right into the beginning of my day, and it carries me through the day. 7.5, 8 hours of sleep at night is all I need to maintain my life. If you're having any of these symptoms, call Mike. He can definitely help you get better. I recommend him with all my heart. He's done wonders for my life.